Hi, my name is Racine. I'm a graduate of Worcester State University, where I earned my degree as a major in biology and a minor in chemistry. I have known my entire life I have wanted to become a nurse. Even my mom has said from an early age I was obsessed with medical. Kids would be watching Elmo or Dora the Explorer, and I was watching Trauma in the ER. I love anything medical, I always have. And I think that my experiences now have just grown that desire. I have volunteered at daycares, I've volunteered at nursing homes, I've done Meals on Wheels, anything that I can to care for people. And now I have shadowed Dr. Jeffrey Hopkins in the emergency room at Milford Regional Medical Center for greater than 3,000 hours. And from that, I have seen the medical setting and how it is and how doctors deal with different things. And I've been a part of central lines, I've been a part of incision and drainage, I've been a part of telling patients and their families that they have cancer, or telling a family that the patient has passed, or anything of that sort. And from that, I found the job of medical scribe, where I could dive deeper into the medical setting and the medical world. I now work alongside multiple physicians, nurse practitioners, and physician's assistants. I now can see how different doctors deal with different patients and their take on the medical field. And maybe they're doing the same, they're doing different suturing, but each doctor is different, and how they deal with a patient is different, how they interpret their findings are different, the different procedures, they go about them very differently. But I think from that, I now have a broad spectrum of how things can be done. But as long as the patient is the center of all that, then that is all that matters. And I now know that I love the emergency room, and I've seen almost every aspect of medicine. I've seen neurology, I've seen psychiatry, I've seen geriatrics, I've seen pediatrics. I've done a lot of different things, and it's only helped really to grow my desire, and I now know more than ever that I want to be a nurse. But the other thing is that at a young age, I dealt with my own medical condition. At age 10, I was diagnosed with ulcerative colitis. And from that, I was on different treatments like trials and medications and all kinds of things to try to get me to be able to live a normal life. And I've now learned that from all those trials, I have developed chronic pancreatitis. But rather than taking it as a negative, I have now made it into a positive, and I believe that from being in that patient aspect, I have learned that I know exactly what the patient wants. I know what the patient needs. I know how it is to be a patient, and as a nurse, I think I could give everyone exactly what they need and just show them compassion and show them that I've been in their position. I know how it feels. And maybe I don't know every single type, but I have a great understanding of what it's like to be a patient and what the nurse should be giving you. And I'm compassionate, I'm loving. I just want to help these people, and I want to make their day just a little bit brighter and show that I really do care, and I will do anything to make these patients feel better or a little bit more comforted. And between the two of scribing and being a patient, I think that I have everything it takes to become an awesome nurse. And I must acknowledge that my grades have not shown that. They, but I've dealt with the medical conditions and trying to go to school at the same time. But I don't think that my grades have shown my ability to become the greatest nurse. And because of that, I'm now in remission. I'm doing great. I am able to study all day, every day. I work a ton. I'm learning more and more every day. And I just need someone to give me a chance. And I want to prove myself to everyone. And I want to show you guys that I could be the best nurse. And I want to share my compassion and love and desire and knowledge. I want to show that to the patients, and I want to be able to spread that around. And I think that I could be one of the best nurses, and I hope that you guys can give me a chance. And I hope to hear from you guys soon. And happy holidays!